สวัสดีครับ Hello everyone. I am Supachai Chinswangwatanakul. I am a staff at the Faculty of Dentistry, Chulalongkorn University. Today is my pleasure to share some ideas about online education that we have learned and we have done so far at Chulalongkorn University. So my presentation comprises three parts. The first one is about online learning, and the second one is about online assessment, and then the last one is about the result or consequences from online assessment. So basically, is student misconduct or cheating from online assessment. Let's start with the first part, online learning in the new normal. When we talk about competency development in dentistry, so the competency itself consists of three parts. So the cognitive part, the affective part, and psychomotor part. So being a competent dentist means that someone needs to be able to use or integrate knowledge, skill, and attitude in order to provide a safe and ethical treatment to the patient. So for online learning, it is possible and it can enhance cognitive-based learning. So basically, knowledge part is still okay for using online learning. And if you use it appropriately, it can stimulate students to learn. So for example, if you use a flipped classrooms, so let students read or do an activity, something before the class, and then at the class you just let them share and learn together. Or maybe you can use a mixture of synchronous and asynchronous learning. Students can learn by themselves and then come to the class and then share and learn together. So it is possible to use online learning to support cognitive-based learning. And online learning may be effective for affective-based learning. For example, when you teach or when you let students to learn how to be a good doctor, how to be a good dentist, learn about communication skill, learn about empathy and other things. So you can use case study or something like that and use online learning. So it may be possible to use that. But for psychomotor-based learning, so basically hand skills, procedural skills. So online learning till now cannot replace face-to-face learning. So students still need to come to the dental school to learn and develop psychomotor skills. I would like to introduce you the 5-step clinical teaching techniques. This is the technique that we normally use in our practice to help students learn in dentistry. So in this model comprises 5 steps: learn, see, practice, prove, and do. So the first 2 steps link to cognitive phase. So basically it's linked about knowledge. Learn and see, learn and see. So basically just use knowledge. But for practice, prove, and do steps, so students need to develop a psychomotor skill or need to use their hands skill. So basically, the first 2 link to knowledge, the last 3 links to skill. Let's have a look how the 5-step clinical teaching model can be applied for online teaching and learning. So have a look. For example, if you want to fold a paper, or if you want to teach students about how to make an origami or something like that, so students can learn from what you explain. Oh, this is origami. This is how you make this kind of the shape or something like that. And then students see you fold step by step, and then students can practice by themselves at home by folding the paper step by step following you, and then they can do by themselves, and then they show the final result. So because we focus on the final product or final result, so online teaching and learning, it is possible to be used for teaching something like this because we only focus on the product. But if we have a look for something like tooth restoration, online learning, is it possible to use online learning to teach tooth restoration? Well, you can see the first 2 steps link to knowledge. It is possible to use online learning to help students learn how to design cavity, how to prepare tools and instruments, something like that. But for the practice, it is impossible for them to learn by using online platform or something like that, because for tooth restoration or tooth preparation, so students need to do it by themselves, and we focus on the psychomotor phase. So the force that they use, the position and other things. So it is not possible for them to do it by themselves at home. So or just using online clip or something like that. They need to practice in the real situation or in the laboratory. So basically they must learn by using the real stuff, not just an online stuff. So basically online learning cannot help students to learn psychomotor skill, because this kind of skills linked to tacit knowledge. How do you know how much pressure do you need to use to apply when you do a cavity preparation? How much force or the position that you need to use an ultrasonic scaler to remove the calculus? So this is a thing that students need an immediate feedback from educator. So that's why it is not possible to use online learning at the moment. But maybe in the future, when the AR, VR, or 3D technologies has been developed and advanced to the level that a student can feel like a real situation, so it may be possible. But at the moment, even the AR, VR, or simulation, students still need to go to the dental school. So pure online learning is not possible to help students learn psychomotor skill yet. And what does it mean? It means that for the courses or for the subject that focus on products, it is possible to use online learning. For example, like a complete denture lab to fabricate occlusion rims. So if you would like to focus on just the occlusion rim, so it is possible to use online learning. So let students do by themselves and then take a picture and send the picture through chat or social media to send to the educator or teachers. So it is possible. Or RPD design. Student design RPD on the cards or on the paper and then submit the paper to educators, so it is fine. Biomedical labs or community projects, so it is possible to use online learning. But for the courses that focus on the process, like operative dentistry, restorative dentistry, crown and bridge, or something like that, or periodontics, so it is not possible to use only online learning. Students need to practice or do things by themselves in the real or in the laboratory situation. So what we have done at Chulalongkorn University, we have done three things to support online learning in terms of the curriculum level. The first one is that we reorganized course schedules and sequences. Like we have lecture days, we have lab or clinic day, and we have like self-study days, and we adjust teaching method, like lecture or seminar, we move to online, full online, can be synchronous or asynchronous. For laboratories like biomedical labs, microbiology, anatomy, biochemistry, we did use online synchronous learning. But for preclinical dental lab, like operative dentistry lab, computer labs, RPD labs, we still provide full face-to-face sessions. And for clinical practice, students still learn in the real situation, so face-to-face. And finally, we adjust assessment method that I'm gonna share with you later. This is an example on how we reorganize a course timetable. As you can see, on Monday and on Wednesday, so it's totally online. So students stay at home and study dental anatomy and other preclinical courses. Could be synchronous or asynchronous. So Monday and Wednesday, students can stay home and learn from home. But for Tuesday, Thursday, and Fridays, students come to dental school to practice in a laboratory. So we have lecture days at home. We have lab days at dental school. At the university level, Chulalongkorn University has already announced how the process or how to adjust teaching and learning methods to follow the COVID-19 situation. Like the green one, a new normal, basically COVID-19 is in control. Everything can be on site or online, but the university focus on blended learning. But when the situation get worse, so things move to online. Apart from some courses that really need to let students practice in the university, so these are exceptions. And the last one, when the university is closed, so all courses must be online. So this is the announcement that the university just provide to all the schools. Now, move to the second part, online assessment in the new normal. Before we talk about online assessment, we need to come back to the basic about competency-based assessment. So this is the Miller pyramid. For this pyramid, it demonstrates assessment at 4 levels. The basic level from knows, just knowledge, knows how the upper level of knowledge shows how knowledge mixed with psychomotor skill. Does this mean knowledge integrate with psychomotor and other part. And for the attitude and character, it can be assessed at any level. So for the DAS level, it focuses on assessment in an authentic environment, in a clinical setting or in the real situation. This level assesses competency of students. For shows how, this one assesses student in the simulated environment, so in a laboratory or using simulation or something like that with no real patient, not a real situation. So this level assesses performance of students. Knows how, basically this level assesses knowledge, but higher level of knowledge like critical thinking, problem solving, application of knowledge or clinical reasoning. And the basic level knows, assess basic cognitive skill like remember, comprehension, something like that. So for each course, there can be several assessment methods focusing at different levels. As you know, in one course, you may use 3 or 4 kinds of assessment methods, and each method can focus on different level of assessment. And for each assessment method, it can assess more than one level. Like if you use like a multiple choice question, if you ask something about what is glass ionomer cement or something like that, so if you are going to assess the basic knowledge like knows level. But for the patient with severe erosion or something, what kind of material this is more suitable for to be used as filling or something like that. So it's you assess knows how level. So one tool can assess different levels, and the assessment level is usually set in line with the course learning outcome. So if the course learning outcome focus on knowledge, so assessment will focus on knowledge. If the learning outcome is to be able to do something in a simulated situation, the assessment will move to shows how. And for the clinical courses, so assessment must focus on the DAS level. Now we move to online assessment. Can online assessment assess every level of the Miller's pyramid? The answer is no. For the first 2 levels, for competency and performance assessment, online assessment till now cannot assess these 2 levels. So look in the reality. So the DAS level, student must do something in the patient, with the patient, or like provide feeling or provide danger to the patient. So online assessment cannot assess student competency. Or even in the laboratory, so student need to practice cavity preparation or composite filling or something like that. So student need to do things in a phantom head or in a plastic tools or something like that. So for online assessment, it is still not possible to assess everything about the performance, because we need to look at student performance in terms of the skill that they use, the position that they sit, and the instrument that they use, or something like that. So till now, online learning is not possible to be used for the does and show how level. But for knows how, it is okay. It is possible to use an online assessment to assess student for like a higher order thinking skill. But for knows, yes, it is okay to assess basic knowledge of the student, but because it's online, you must be aware of cheating or plagiarism. So if you want to use online assessment, try to focus on knows how level. Now we look in detail for like clinical practice. Normally for clinical practice, it focuses on practice in the real situation with the real patient. So we assess competency of student. So it is not possible to use online assessment. Yes. And for preclinical dental labs like operative lab, computer labs, PROS lab, perio lab, something like that. So student practices in simulation or in the laboratory, and the assessment focus at the shows how level. So for online assessment, it may be possible to assess products as I mentioned earlier about the five steps clinical teaching model. It is possible to assess product, but it is not possible at the moment to assess performance. So you need to keep in mind that, okay, for preclinical dental labs, online assessment is okay for the products. For basic science or biomedical labs like anatomy, physiology, biochemistry labs, something like that, for the assessment, it could be shows how level. Let students do dissect cadaver, or preparing a slide, or preparing a substance and mixing substance and see the reaction or something like that. So that is shows how level, or knows how level, like lab result in interpretation, or reading pathology slides or something like that. So it depends. But basically, if you assess knowledge, it is possible to use online assessment. But if you focus on performance assessment, like you need to let students show how to stick plate in a microbiology lab, something like that, it is still not possible to use online assessment at the moment. And for lectures or seminars, so as you know, these two types of courses only focus on knowledge. So it is possible to use online assessment. So there are 4 points that we have learned at Chulalongkorn University. So the first point is that online assessment, it is possible to assess cognitive domain. The cognitive domain, basically knowledge. But the assessment of professional skills or affective domain, like professionalism, how to be a good doctor, how to be a good dentist. So online assessment is still questionable. Cannot fully replace face-to-face assessment. And online assessment can assess product, but not the process. So basically, online assessment is still limited to be used. And the second one, online assessment doesn't prevent cheating or plagiarism. So basically, try to avoid assessment at the nose level. If you want to use online assessment, try to move to nose house level. So at least let students think and develop the idea by themselves, not just remember things. And if cheating or plagiarism is of your concern, try to change from written exam to something else like oral exams or other assessment methods like assignments, report, or let students record their own video like personal reflection. What I have learned today from the session, what I have done so far, this is my result, this is my product. They can record video and send to the lecturer. So change the way you assess students to avoid cheating or plagiarism. And finally, everything about online learning require time, require resources, and you need to communicate all stakeholders in advance. And if you want to use online assessment, the test run or readiness test is recommended. So let students come together before the exam period and then try the online system, try to submit example of work or something like that to let students be familiar with the online platform. And part 3 is about the consequences of online assessment. So for the last 2 years, since things moved to the online platform, we have found the growing number of students with misconduct or perform something like online cheating or plagiarism. So I would like to share with you about this issue. So cheating, plagiarism, and student misconduct are growing and more difficult to detect because students, they are techno geek. They know about technology more than us, so they know they have lots of ways to avoid and to avoid surveillance or proctors, something like that. I really like this clip. Teacher call it cheating, but we call it teamwork. So well, this is different perception, but cheating or plagiarism is still unacceptable. We need to teach students about the moral and ethic of this issue too. So what kind of online assessment misconduct that we have found so far? So you can see the list, but the red items are commonly found. So we have found lots of students have done plagiarism. Some of them know, some of them they don't know how to avoid plagiarism or something, but some of them intend to do plagiarism. So this is a thing that we need to focus on more and more about plagiarism. And then because it's online, students sometimes send answer to other students using the chat application or social media. And because it's online too, lots of students breach exam regulation. Like the exam regulation said that you are not allowed to access a website, any website to get answer, but students still access website to get answer or chatting with friends or something like that. So these are the things that we have found. And this one I would like to show you. This is me to give an example. So how do you know that there is no other student or other people around when student is taking an exam? How do you know? Sometimes you need to let student pan the camera around to make sure that no one's with the student. But can someone hide under the table? We have found someone hide under the table to tell the answer to student. Can someone sit in another room, open the door, and then come to the room later? Or someone shout the answer from another room. So because students need to mute the microphone during the exam, so the student can talk or something and you don't know. So it is very challenging. And I want to show you this one. Yes, even you let student pan the camera around to make sure that there's no one around there, but it is still possible to cheat the online exam. So don't rely on just panning camera around. So there must be other measures to prevent cheating or plagiarism. Also, a proctor is a must if you would like to use an online exam or online assessment like this one. All other students, they just focus on their exam paper, but only the bottom one, you can look at that. Student look at another direction. So we know after that, we knew after that that students stick the answer on the wall. But basically because the camera cannot catch that one, but we knew that. So basically a proctor is very important. I would like to share with you about an interesting student misconduct cases. For this one, for student, the camera turned on from 1 o'clock until around 8 minutes past 1, and then the camera turned off, and then the camera turned on again around 1:11 or something like that, and then turned off again from 1:14 until the rest of the exam period until 3 o'clock. Student said he turned the camera on all the time and use his own device to do the exam. But what we have found is that the exam platform has been accessed using different devices from different places and from different IP address and from different places. So finally, we found that the exam was accessed from two places. One place was the place that students sat there to do an exam. Another place was that someone else helped students to do the exam. So we found this one. So we traced back to the IP address and this case. Finally, the final verdict from the evidence and student behavior. So we conclude that is 100% cheating because we got all the evidence from the internet provider and all the sources of evidence. So it's academic misconduct. So the student breaches the undergraduate regulation. So the final verdict was that students fail on that subject, and for other courses, student was forced to withdraw all the courses and need to study that semester again. So this is the final verdict for this case. So finally, when we talk a lot about online teaching, online learning, online assessment, and student misconduct as a result of online assessment. So I would like to give you a recommendation for moving toward online education. So what kind of thing you need to concern about? I would like to share you three things. The first thing is, if you would like to move to the online education, any kind of online, faculty development is a must. So basically train your own staff to understand online education, and support from the institutional level or the school level must be available. So sufficient or adequate support, and all the policy, regulations, and other system should be revised or adopted to be more relevant with the online education. And finally, you need to listen and talk to students more, because student engagement help you to understand what students think about online education, online teaching, learning, and assessment. So students can give us invaluable feedback to us to adapt and adjust teaching and learning to help them learn effectively. So three things: faculty development, support, and student engagement are a must. So the final message is that what teachers like may not necessarily be what students like. So teachers or we and our students must talk to each other more. So now it's online, everything online. Sometimes it's quite difficult to see face to face, but at least we need to talk to our colleagues and students more to make sure that the things that we're gonna change or the way that we're gonna move to are okay, and they are appropriate way that we all can move together. So this is my final message: talk and engage a lot with your colleagues and your students. So thank you very much for your time. I hope you enjoy my presentation and gain something from today's presentation. So please feel free to contact me if you have any question or you would like to discuss further more about the online education or any issue regarding dental education. I'm more than happy to talk to you. So thank you very much. Have a good day. Take care. ขอบคุณมากครับ
Welcome to Faculty Development 2022. Here we are the Faculties of Medicine, Sirirat Hospital, Mahidol University, Thailand. Today we come up with a topic of how COVID-19 affects the JEP programs. So it's my honor to say with Dr. Vitoon, Chinswangwatanakul and Dr. Asada Methasate, our program directors and associate program directors. So good morning, sir. How are you doing today?
Good.
สวัสดีครับ
Yeah, so let's begin with the first questions. How is the current situation in Thailand right now?
Right. I wanted to say that at the moment we are in the wave number 3, if we count from the beginning of COVID pandemic in 2019, and so far this wave create a lot more people, a lot more patients that already infected with the Omicron, as we all know. But the situation, in summary, is under control by the government. So when we look at the effect of the COVID-19 to our JDP program, we will see that every time we got a new wave, the students may be affected by the shutdown of the city for the first and second wave of the COVID infection. But this wave, it might be better, I would say that. Anyhow, for the last 2 years that we already stay with the COVID, we have to admit that our JDP students have been affected in all first and second year of our trainings. And so far, we try to support our students as much as possible, even though the situation in the country is quite fluctuating. And every time we have to shut down any activity, we try to support our students by using the technology such as Zoom conference or hybrid program learning, as well as even the laboratory jobs that they have to carry on. We try to support them as much as possible.
So how about the current situations in the JEP program? Can you briefly explain about the program?
Yes. 2 years have passed since we start the joint degree program between our institute, Mahidol University, Srinagar Hospital, and Tokyo Medical and Dental University. And we have each year 3 students enrolled, and that is the maximum capacity that we can have. The students enrolled are specializing in general surgery and vascular surgery and pediatric surgery. We have a lot of students who is interested in joining our program. One of the advantages of our program is that we are emphasizing on research, and at the same time we have the students exposed to excellent surgery or clinical application. And another advantage is that we have combined program between PhD program and clinical fellowship, and a lot of students are interested in joining this program. So far, I think we have a successful program and management of this joint degree program.
So may I ask how the COVID-19 affected the program?
Right. Actually, we have just conducted the survey in our 6 of our JDP students, and you can see on the slideshow that all of them agree that they have been affected by COVID-19, and the majority of them already told us that they affect on the lecture program and also for the clinical participation, and majority also affected the research plan as well. And when we look at the confidence in the conducting research, pretty much of, let's say that 2/3 of them still be confident, even though 1/3 may be reluctant. And when we look at the effect on the access to the supervisor, I'm quite wonder why only half of them feel be comfortable to access to the supervisor. That may be the major effect really in the COVID-19, that people may not be able to see each other face to face. That might make some inconvenience. And we look at the effect of time management. I think all of them very good to manage the time. That means they are very flexible on both sides. I mean the student side and also on the clinical or supervisor side as well. And we look at the effect of the physical health. The majority of them, about 83%, feel comfortable and still be in a good health. And when we look at the effect of the mental health, it's at the same. Majority of them still be happy with the situation. And finally, when we look at the effect on overall quality of life, majority of them still be happy. So when we look at in summary, I think our trainees feel that the COVID-19 affect to his way of life in either physical effect, I mean the way they living, or the mental effect, but they can adapt themselves to suit. And by the way, even the research seem to be affect compared to the other aspects. But I think we are going to support our trainees every time we can on every aspect that we can do. And I think the situation overall seems to be better. For the last 2 years, even our trainees and trainers have to spend some time to support the faculty, either look after the COVID patient, to join the vaccination camp, or sometimes we have to go to the hospital to support the patient in responsible with our faculty. We still be able to survive in terms of the academic support and academic activities carry on pretty nice when we look at the overall result from the survey we just done recently.
So how about like the lifestyles, and do they have any comments? The students have the comments about like the travelings or anything that they gave a comment to the program?
Yes, because this program, the student has to go to Japan and to study at Tokyo Medical and Dental University for at least 6 months. Yes, the COVID situation affect the period of their travel and when they can go to Japan. But I think the situation is getting better now, and we have shift the period to the second half of the program so that the students can go and have clinical and research experience at Tokyo Medical and Dental University. Most of the students will stay in Japan for about one year, and that's the average, and they think that they can have a lot of clinical experience and research there.
And even though we cannot fly to Japan now, but I like to thank the TMU team from Japan that we keep connection every one or 2 months by the online connection that makes us feel comfortable of the program to continue, and we optimistically think that probably at the end of this year or the beginning of next year, we might be able to travel to each other. I mean, exchange trainee and trainer to each other.
Oh, that was so nice plannings, and I hope everything will be doing great after the pandemic, and hope all of your students be able to fly to Japan and they can do all of the research that they want to do. So today I have to say thank you to both of you for our interview for today. And I hope you guys have a wonderful day and great evening today. Thank you. สวัสดีค่ะ
ครับ
Hello, I'm Dr. Juan Pablo Torres. I'm pediatric infectious disease specialist from the Faculty of Medicine at the University of Chile. And today I would like to talk about the impact of the pandemic of COVID-19 and the impact on the education and the Chilean experience that we lived during these last 2 years. This is the situation now in Chile. You can see that we have a first outbreak of COVID-19 during the beginning of the pandemic, at the beginning of the 2020. Then we have a second high number of cases. This was in the last summer of the last year, and now a very high impact and very high numbers of COVID-19 cases because of the Omicron variant. You can see in the bottom in the graph the number of the intensive care unit admissions that was very high last year, but this year the number of beds that were occupied was much lower. The numbers in Chile means that at this moment 1 every 5 Chileans have a detection of SARS-CoV-2 infection after these 2 years of pandemic, and around one every 430 Chileans have died because of or with the detection of SARS-CoV-2. In Chile, the government and the state implemented different areas of action plan that includes quarantines, national curfews, changes in the health system, integration between the public and the private health system, an economic plan, transportations, and other factors. But I would like to emphasize that we have to make some changes in our educational system and also improve and started with a very, very intense immunization program. The main health strategies in the country consist in the strengthening of the health network. We have to increase the intensive care unit beds in the country by 3 or 4 times compared to the historic number of the ICU beds that we used to have here in our country, and the integration between the public and the private system to have a good number of beds available for the increase of number of cases that we had in the country, and also increasing test capacity. For this, in the experience here in Chile, the role of the universities was very relevant because by the Ministry of Health and the Ministry of Science here in Chile, and the cooperation between the universities around all the country, Chile can have a university network that collaborate with the testing for SARS-CoV-2 in more than 120 labs, and we can increase the daily number of detection by PCR for COVID from 2,500 to 35,000, and at this moment we are around 90,000 tests every day. Also, some containment measures, the control of borders, sanitary cards, some mitigation related with the restriction of activities. And a key factor was the closure of a school and universities at the beginning of the pandemic. The first case of COVID-19 here in Chile was on March 3rd of the year 2020. And only 2 weeks after the first case in Chile, around March 16 of the year 2020, all the school and all the universities in the country were closed. Another mitigations measures included the social distancing, the traceability and isolation, and some dynamic quarantines. And also the state started by the Ministry of Science and a data committee, a comprehensive participatory information system, technical advisory council by the Ministry of Health, a committee from the president, a presidential crisis committee, and also a social committee. And with this, another key factor here in Chile, and was I think it was a key factor because it was very different compared to another countries here in Latin America. The vaccination program that was established at the beginning and then during the pandemic was very, very intensive because it was a decision to maintain the intramural and extramural vaccination program, to reinforce the vaccination in the primary, public and private care, and promote vaccination opportunity, update on delayed vaccination schedule, and keep a stock available of the COVID vaccine, but also for all other vaccines that are part of our national immunization program. And the timeline for the COVID and the universities is the following. So all the universities, the public and private universities, were closed on March 16 of the year 2020. And they changed all the teaching activities to online activities. And of course, in the medical field, we have a lot of challenges, including our university, the University of Chile, that is the main public university here in our country. Many challenges for the clinical practice for our students. So we have to improve some type of simulations, some types of other techniques for the learning of our students. Then in the second semester of the year 2021, a partial reopening was started at the universities. And now this year, well, some days ago on March 14th, we have a full reopening of the university system here in Chile. And now we have the challenge to have a monitoring of what will happen with the contact, with the infection of the COVID between the students. But probably we think that because a very massive vaccination strategy was implemented in our country, you can see here that in adults, that include our students, more than 93% of all the adults more than 18 years of age here in Chile had a complete scheme for COVID-19. And our population here in our country, that is around 19 million of people, we have administered in this massive vaccination program in the country more than 3 million of booster dose in our population. So at this moment, more than 96% of all the students at the university, at least at the University of Chile, has a complete scheme and immunization for COVID-19. Also, Chile was one of the first countries in the Western of the Western countries in the world that started vaccination in children, and not including only adolescents. So that's meaning including also children less than 12 years of age. And at this moment, more than 82% of all our children in the country have a complete scheme for COVID-19. Also, the pandemic is dynamic, and we have the closure of our universities, and we have information, and this information was generated by our researchers, and including our group here at the University of Chile and the Faculty of Medicine, together with the Faculty of Engineering, that the seroprevalence and the detection of antibodies decrease after some months in people, in adults that receive 2 doses of the inactivated vaccine. So with this data, the state decided to implement a booster dose, a 3rd dose for all the people in the country, and also measure the effectiveness of this booster dose. And as you can see, for the inactivated, the RNA, and also the vector-based COVID-19 vaccines, we can see an increase of the effectiveness for the disease, and also for the to protect for hospitalization, that improve around 90-93 or around 90-95%. So this is very dynamic, and this also includes our students at our university. Of course, as universities, we have a compromise with our country, and the University of Chile is a public university, so we have the opportunity to develop some contribution during the COVID-19 pandemic. And universities are playing a key factor to generate evidence, to improve the diagnosis, and to give information and data for the government and for the Ministry of Health, for the Ministry of Science, to have a better decision at the public side. So we can have some experience, and we publish some papers in our groups here at the University of Chile to improve diagnosis. For example, the detection of the virus using pool testing, or doing some studies of prevalence in students and at schools, and also in adults, to have some input, some data about the PIMS or MIS-C, the multi-systemic inflammatory syndrome that can develop some children because of COVID, and also a very relevant participation of our faculties in vaccine studies. Here in Chile, we can develop phase 3 studies for the different platform of COVID-19 vaccines, for inactivated vector-based vaccines. So this was an important participation that allows the government to negotiate and have access to more numbers of doses with the pharmaceutical industry, to have some numbers of doses for our country. So this is part of the strategy. And what happened with COVID-19, and this is in Spanish, and the schools, I mean, not only the universities, and you have to know that here in Latin America, and these are data from the UNICEF, Latin America was the region of the world that have more numbers of days of close of schools compared to any other region in the world. So this caused a lot of damage in the learning process and the health, mental health of our children here in our countries. We can have the experience to publish and generate data, as I mentioned before. This is published in the Clinical Infectious Disease. We did one of the first antibody prevalence studies in a large school community here in Chile. And after studying more than 1,000 children and more than 200 adults of a school community, we can observe that in a student compared to the teachers, the seropositivity after the exposition to the virus was the half in the student compared to the teachers, that most of the children, not most, but around 40% of the children that were seropositive for COVID-19 had or presented asymptomatic disease, compared to only an 18% of adults that have also antibodies detection. And also the transmission at the schools, and this was very early data that then was confirmed by the other European and North American studies, the detection of the transmission at the schools, and this could be at least a little bit similar at the universities, is more between adults and from adults to children. More than between children or from children to adults. This was also information from the United Kingdom, from the group of Dr. Shanes Ladhani, that shows that the impact of the schools in the community, and that's mean how the schools produce an increase at the community of COVID-19 cases is not observed as usual. The most usual is that the schools reflect what is happening in the community and not in the opposite direction. Most of the times, the adults are the ones that cause the outbreaks at the school. And now, at this moment, at the end of the last year, more than 80% of our students in all the schools in the country have a complete scheme for COVID-19 vaccine. We are doing some step forward. This is an article in the main newspaper here in Chile. It's an article that mentions our study at the University of Chile, and we are studying now the immune response in children, in more than 2,000 children in the main three regions of the country, what's happening after they receive the COVID-19 vaccine. And here we have the data. I'm not going to mention in detail, but because we see that children and also adolescents, more than 2,000 that received the Pfizer or the inactivated vaccine, after the second dose, they have a very good detection, and for a good number of weeks after they complete the second dose of the scheme of the COVID-19 vaccine, that are allowing us to generate data and give this data to the Ministry of Health and Ministry of Education. Both of them were part of the study, together with the University of Chile, and also we can have a more strategic and a more evidence-based public policies. So at this moment, during the pandemic, we have also waiting for an effective vaccine for all the variants. We are now in our universities could be and could have some possible outbreaks, and of course we need to have a very high coverage for all of our universities and generate strategies. Here, if you can see the information here in Chile, official information about the variants. And you know that during the COVID-19, we have changes of the predominant variants. For example, in the last year, 2021, we had Gamma variant, then Delta, and now we have most of the cases are caused by Omicron. So this is a challenge for all the university system to have adequate measures to be implemented depending on the dynamic of the pandemic. At this moment, this is information of the last years, you know, even, for example, in Europe, this is information for Europe that just passed an Omicron wave that was very important with a lot of peaks at different European countries. They, after decrease the number of cases of COVID-19, and then you can see that in some countries like Austria, the Netherlands, Switzerland, Germany, Greece, the cases are increasing again. So this is a challenge. The pandemic is dynamic, and at the level of our universities, we need to have data to take the most specific and cost-benefit measure to be successful in the way to don't have outbreaks with our faculties and our students at our universities. So in our country, at least here in Chile, we have two main strategies that have to be implemented together to be successful. I'm sorry because this is in Spanish, but this is autocuidado. So the self-protection measures are very important, but they have to be implemented together with with vaccination for COVID-19, and that have to be at time and also with high levels of coverage. So in this way, we can see and try to avoid what is happening, for example, at this in the last day or in the last weeks in the Europe, that also they are having a small increase of hospitalization admission because of COVID-19. This is also another interesting data that was published in the Financial Times and shows what is happening with the case fatality rate by COVID-19 compared to the seasonal flu. So at the beginning or at mid 2020, the COVID-19 case fatality rate was 20 times or more than 20 times the influenza case fatality rate. But then when the countries, this is data from England, started with the vaccination, then implement booster vaccination, and then have circulation of a more contagious but less lethal variant like Omicron, you can see here that for the first time during the pandemic, the COVID-19 infection fatality ratio is less than the seasonal flu fatality ratio. This could mean that now probably we are moving more to an endemic situation that can allow us to have a more regular and a more normal situation at our universities. So it's very, just to finish, to remember the use of mask, the hygiene of our hands, and wash our hands very, very, very frequently, and the social distance and the ventilation in all the spaces and the auditoriums of the universities are very, very relevant also. So this was I think, part of our experience. This is part of our data. And probably this is part of our lessons related with the pandemic, the university system, and some challenges that we still have in the next month, or maybe in the next few years because of the pandemic of the COVID-19. Thank you very much, and it was a pleasure to be here with you. Arigatou gozaimasu.
Today, I would like to talk about challenges we all have faced since the outbreak of COVID-19, sharing with you how we have coped with the situation caused by the pandemic here at TMDU. First, I will talk on common challenges presented by the COVID-19 pandemic, and then changes in education accelerated by COVID-19, and finally, TMDU, the experience. In the US, college and university presidents are periodically asked on challenges presented by COVID-19 since its outbreak. According to the results of the most recent survey, the most pressing issues for them were student mental health, faculty and staff mental health, long-term financial viability, and enrollment numbers. It is quite understandable that the financial issue is always, regardless of COVID-19, the major concern for presidents, but they are also very worried about mental health of students and faculty staff. The most common mode of instruction since COVID-19 were predominantly online with some in-person instruction, 57%, predominantly in person with some online instruction, 35%, exclusively online instruction, 7%, followed by exclusively in-person instruction, 1%. This survey covers different types of higher education institutions, but generally speaking, you can see that online instruction with some in-person instruction is the most common mode. How is the situation like in your own institution? The report on the same survey also indicated that in the area of student services, presidents most anticipate keeping changes or adaptations due to COVID-19 were academic support services, academic advising, student counseling and mental health services, and admissions. They feel the need for virtual events and activities, including options for virtual orientation, campus tours, and meetings. Presidents also shared plans of continued remote access for academic advising, counseling, and other support services. Having read this report, I was most impressed by this part. One president of a public four-year institution reported that the pandemic has brought greater visibility to telephonic and Zoom-linked resources that were already available and that are now seeing greater use. In Japan, we are very much aware that digitalization in our society is pretty much delayed despite the existence of available technology. People need something to take actions. Also, one leader of a private four-year college explained hopes to continue to offer more flexible academic programming for meeting the needs of students via virtual, hybrid, and online offerings, especially for our adult students. So it seems to me that for some leaders, COVID-19 serves as a trigger to move forward or to do things differently. In the area of education, I think we observed some changes triggered or accelerated by COVID-19. I suppose all the faculty at least once think of possibility of implementing exams online. The pandemic situation made us rethink the way we assess student performance. These are the factors we need to think when we decide on the appropriate assessment methods. What are the learning objectives we would like to assess? The exam should be proctored or not. In other words, watched or not. How long will it take? During the exam, student can refer to materials or not. The assessment is done as formative or summative. If it is done as formative, it has low or no impact on students' grade. But if it is done as summative, it has a big impact and can be high stake. As we know very well, this is Bloom's taxonomy modified by Gilbert. Learning objectives are classified into these three domains: the cognitive domain, or simply put, knowledge, the affective domain, or simply attitude or habit, and the psychomotor domain, or simply put, skills. In the cognitive domain, if you want to check just students' recalling facts ability, objective tests like multiple choice questions might be suitable. But if you give such objective tests with fixed correct answers online, you might encounter difficulties in completely avoiding students' unethical conducts. It is really a matter of reliability between faculty and students. Since we all are teaching future healthcare professionals, we hope we can trust our students. But unfortunately, it is not always the case, isn't it? Before COVID-19, most of the exams were implemented in classrooms and proctored, watched by faculty or staff. COVID-19 has made us rethink not only possible risks involved in online assessment methods, but also which learning objectives we truly want to assess. In higher education, do we still need to check how much our students remember the facts? If you want to assess students' higher taxonomic levels of cognitive domain online, take-home examination or open book examination will be more appropriate. I wonder whether some of the listeners have already tried this mode of assessment or not, but I think it's worthwhile considering these options. Take-home exam and open book exam are sometimes interchangeable, but according to the homepage of the University of Utrecht, they differentiate these two as shown in this slide. A take-home exam takes several days. Student can refer to any materials and do it anywhere, while an open book exam is conducted within a few hours and usually proctored in the classroom. They can refer to approved materials only or sometimes no limitation. Of course, there are some basic rules from the standpoint of academic integrity. Also, faculty need to prepare good questions whose answers students cannot easily locate in materials readily available in the library or on the web. Good questions mean questions which will require students to engage in deeper thinking or higher level cognitive activities. I feel the necessity of faculty development to learn more about this issue. For the latter half, I would like to touch on TMDU's experience since the pandemic. Since April 2020, all the didactic courses in its undergraduate and graduate programs have been provided online, synchronous type by Zoom or asynchronous type through WebClass. WebClass is a learning management system we use at TMDU. Some students prefer online instruction to in-person instruction, while some don't. Since the students stay at home, less tardiness was observed. As for practicum, students are divided into 2 or more groups to avoid 3 C's: closed spaces, crowded places, and close contact settings. Undergraduate exams were conducted mainly in class proctored. Clinical training at TMDU Hospital for undergraduate dental students and trainee residents were suspended during April to May 2020. And staff and some faculty work from home. I would like to share the experience of conducting a recruitment examination for the dental residency program. Up to the pandemic, we screened the candidates based on application documents, written exam consisting of English test and short essay writing, tooth carving as skills test, and interview in person. Because of COVID-19, we replaced tooth carving with a clinical reasoning written exam and have implemented everything online using Zoom and web class. Microsoft Teams was used for communications among faculty staff to cope with possible emergencies. The second experience I'd like to share with you is in the dental residency program. In Japan, after the 6-year undergraduate dental program, students take a national licensing exam just before graduation in March. In order to have their own clinic, the law requires them to complete a 1-year mandatory clinical training at the designated institutions. TMDU is one of them, and TMDU Hospital accepted dental trainee residents in April 2020. But dental treatments in its dental division was extremely restricted because of the COVID-19 pandemic. The residents could not treat patients for 2 full months, so the faculty developed Presentation of Dental Topics PDT online course, which was aimed to further their ability of solving clinical questions and presentation skills. This experience was introduced in the Journal of Dental Education. The outline of this online course is like this. At that time, 39 newly licensed dentists were on the residency program. 39 clinical questions in 6 domains were prepared. 6 domains were oral care and periodontics, operative dentistry and endodontics, dental materials, prosthodontics, oral surgery and systemic management, and others. 39 dental residents chose one topic each, no overlapping. The residents were given 2 weeks to prepare presentation materials on the clinical question they chose. That sounds like take-home exam, though it was not an examination. And then they gave their first presentation among the group, got feedback from the tutor and group members, and then revised their original presentation accordingly. Then they made the second and final presentation to all the members. Each presentation consisted of self-introduction, 5 minutes, presentation of the clinical question and their answers, 10 minutes, followed by Q&A plus feedback from the program director for 10 minutes. According to the results of the anonymous questionnaire from the residents who took PDT, 87% of them responded positively to the effectiveness of this online PDT course. Multiple comments referred to 39 residents presented thoroughly different topics, which were useful for acquiring various knowledge. At the same time, faculty noticed the weaknesses, such that TMDU's library service was not completely available on the web. Clinical training was resumed after this online PDT, but faculty recognized an urgent need to consider such online programs to acquire clinical techniques remotely. Even before COVID-19, TMDU School of Dentistry has started designing new undergraduate curriculum based on fully online didactic courses, mainly asynchronous type through web class, open to first to sixth year dental students. Due to COVID-19, those who were dubious about online courses had no choice but to use Zoom or web class for their teaching, which resulted in lowering their psychological barriers for online teaching. We are still in the midst of working on this new curriculum, but hopefully in the near future, we would like to share the updates of our endeavor with you. If we promote more online teaching and learning, our students need to be more aware of and accountable for their personal management skills and academic integrity. This is my personal experience. I was in charge of a purely online course, a synchronous type on web class in this academic year. The students were expected to watch the videos. I can check the log to know how long they watched the videos or at least accessed the site. Very few students accessed the site for less than 1 minute. And of course, I needed to talk to them. So I strongly feel the necessity of a session or course for personal management and academic integrity in the very first year of the undergraduate program. And finally, we faculty also need to have a clearer vision on learning objectives and appropriate methods and assessment for more student-centered and outcome-based education in the new era with and after COVID-19. With this, I would like to conclude my presentation. Looking forward to your feedback and or comments. Thank you very much for your kind attention.